This video is over how gluten can affect the brain. So what I simply do, an explanation for parents. So what I do is I draw the brain out, and then I draw the cerebellum, and then I'll draw the gut lining. And what I'll say is there are cells inside your gut lining that should be nice and tight so that little micronutrients can get through, but nothing bigger can get through. But when a kid has a gluten sensitivity, it starts breaking down their gut lining, which puts gaps in here. When we get gaps in here, gluten proteins can get through your digestive system into your bloodstream. When they get into your bloodstream, they shouldn't be there. So your immune system, kind of like these little Pac-Men, they go in and they grab that and get rid of it. The problem is gluten proteins are almost identical to proteins in our cerebellum. It's called molecular mimicry. So our own immune system starts attacking and creating issues in our cerebellum, and we start to see signs consistent with their cerebellum. So maybe they have poor balance, they have poor coordination, they can't fixate their eyes when their head moves, they can't track appropriately, and they have a lot of different primitive reflexes. So a lot of times just by taking gluten out of their system, it calms down inflammation in their cerebellum, and then what we can do is we can rehab that more effectively. So if someone's having a really hard time, if you say take gluten out of their diet and they really are resistant to it, I just simply say, here's what we're going to do. We're going to take gluten out of your diet for 2 weeks. That's it. And I want to see how their neurological system changes. Does their cerebellum change? And then you can show them that change after 2 weeks. If it doesn't change, it's not the problem. But if it is the problem, or a problem or contributing factor, then when you make that change, you're going to see their primitive reflexes get better. Their Babinski reflexes get better. They can now fixate their eyes and keep their eyes stable. Their eyes can track more appropriately. They can balance. In man's test, maybe they went 5 seconds, now they went 20 seconds. So that is how I explain it to them simply. And then I just give them a simple instruction of, we're going to take this out, and then we're going to see how they respond. And usually parents will understand that, and they'll be able to do that for a couple weeks. They'll try really hard for a couple weeks. Then once they get through those couple weeks, it almost becomes like second nature. It becomes a lot easier for them. So there you go.
Thanks for taking the time to check out this video. To learn more or to schedule an intensive or anything with my team, there's a link below. Just go ahead and click that, and that'll get you to the right spot. Have an awesome day.